And welcome to Conversations. My name is Jason Plotkin. I am the Program Director at Congregation Emanu here in Houston, Texas. And every week we sit down with a member of the congregation, community, or perhaps from the sports world to discuss the current state of affairs. COVID has been taking many of the headlines for months, but we cannot forget about the flu. In today's conversation, we'll be discussing what flu season looks like and why COVID certainly presents challenges to flu season and vice versa. I'm actually recording this broadcast in memory of my brother, Raymond Plotkin, who passed away from the swine flu during that pandemic a few years back as a college freshman at the University of New Mexico. While we vaccinated him for the flu, H1N1 was not readily available as a vaccination at the time. This broadcast is actually airing on the yahrzeit or anniversary of his passing. So to help us explore more about the flu season during a COVID pandemic, we are fortunate enough to be joined by our congregant, and I'm going to call him our friendly neighborhood infectious disease expert, Ed Septimus. Ed, welcome to the broadcast. How are you today?
I'm fine, and thanks for asking me to participate.
Well, I'm really appreciative of what you are doing here at a congregation and in the Jewish community. And I think before we dive in, I think it's important to highlight some of the work you've been doing. So for those not familiar with some of the things you're doing in the community, do you mind sharing some of the general high-level recommendations you're giving to institutions and the work that you're doing out in the community?
Sure. Well, first let me say it's been a pleasure, an honor, and actually a great responsibility to work with our general community. So I've been advising a number of congregations, schools, and businesses. And my basic message is to them is that we need to put science over politics and fear, that we have to be able to learn to live with this virus until such time as we have an effective vaccine, or what people have termed herd immunity. And what I've basically said is there's about 5 things that we need to do consistently well. Masking, avoiding crowds, make sure we do social distancing, try to use the outdoors as much as possible. And of course, we're in a time in Houston where it's wonderful to be outdoors, and make sure we wash our hands and disinfect high touch areas. And I think if we all do these things consistently well, we're not going to get rid of the virus, and we're not going to make the risk zero, but we'll greatly reduce transmission and allow our community to be open. So that's been my message, to try to take the politics and fear out of that and try to provide the science and just some basic principles. Now, I also tell people, what's the first thing that most of us do when we get in our car? What we usually do is hopefully put on our seatbelts. And think about that. It becomes second nature to us. We don't even think about doing that. Think about going out in our community and using masking to be like seatbelts, that we just carry our mask with us. I've got masks in my car. Of course, I have masks when I make rounds at the hospital. I have masks at home. And whenever I'm going to be among people, especially if I can't social distancing, and especially if I'm indoors, I'm always got my mask on, and it becomes second nature to me. And I think that's the way our community needs to think about doing these sort of things. It's going to become, unfortunately, the new norm. So that's the message I give people, that we can learn to live with this, but it's going to mean individual responsibility and a greater sense of others. So when I put my mask on, Jason, I'm protecting you if I'm in your same space. And when you put your mask on, you're potentially protecting me. And of course, we're particularly concerned about protecting our most vulnerable. So that's the message that I give our community.
All right, you mentioned staying out of the political arena, so I'm going to try my best, but there were comparisons made by individuals with significant platforms that COVID was like the flu. My question to you is, where do the comparisons stop? And what are the significant contrasts between COVID and what we would traditionally know as our seasonal flu?
Well, yeah, there were some comments made early on in the pandemic. And so for fairness, there was a huge knowledge gap when COVID-19 hit our community and in our world. I'm happy to say that we've greatly narrowed that knowledge gap. Just to give you an idea, there's been over 500,000 publications on COVID-19 since the beginning of the pandemic, and it's extremely difficult, even for someone like myself who does this, if you would, for a living, to keep up. But the knowledge that we've learned has been significant. But in the beginning, this looked like a respiratory virus. which influenza is. And it looked like it was transmitting from person to person. And the symptoms were in some cases similar, but as we've learned, COVID-19 has a more diverse group of symptoms, and it can basically affect every organ system. As an example, it's losing your taste and smell and taste, which actually is very specific for this virus. Now, what's different about it, of course, is number one, it's more contagious than common flu. And in certain high-risk populations, the mortality or the case fatality rate is higher. So it's more contagious, and if you would, is more dangerous than flu. And so that's one of the things that we've learned sometimes the hard way.
And then, you brought up the safety precautions and the general recommendations. In some ways, we have an opportunity to learn from the Southern Hemisphere. We're in the Northern Hemisphere because the flu seasons are opposite, just due to, how the hemisphere is positioned. My parents will be very proud that I'm bringing science into this. But is there something we've learned from what's going on in the Southern Hemisphere with their flu season during COVID that will benefit us here on the other side of the planet?
Yeah, that's a great question. I just want to add one other thing to my previous answer, and that is just like influenza, we've also learned that people who can have no symptoms with COVID-19 and still possibly transmit the virus, which is why we have this universal masking recommendation. Influenza, by the way, in a couple of days or a day before they get symptomatic, can also have virus that can be transmitted, but more so with COVID-19. So I wanted to make that point. In terms of the Southern Hemisphere, we always look to the Southern Hemisphere because their seasons are reversed of ours. And usually they can give us a preview of what we might expect this winter. What we're seeing in the Southern Hemisphere is that we're seeing a significant decrease in flu activity. There's two explanations for that. One is that the COVID-19 virus is much more robust and basically is crowding out influenza, again, during this first pass that we're seeing with COVID-19. The second is, just like we are in this country, they are social distancing and wearing masking, which may also reduce not just COVID transmission, but influenza transmission. So which one of those factors or both are playing a role, we don't know, but we do know, and this is an important fact for folks watching this, is that you can be infected with both influenza and with COVID-19.
And that kind of leads to my next question. Obviously, COVID testing is something we're all aware about. The stats are published every day, spread across the media. We're recording this as the numbers are continuing to go up with record-breaking numbers. So how are medical professionals going to decide what exactly to test for? Are they going to test for just COVID, depending on what they see, or the flu? Are they going to test for both? And you just mentioned, I guess, that someone can conceivably test positive for both at the same time. What does that testing look like?
That's a great question. Well, first of all, we have some sentinel sites in and around our community that regularly during this time of the year begin to report positive flu cases. So we'll know from the health department whether or not influenza is in our community. So that would be the first sort of step. Secondly, most offices and emergency rooms have rapid testing now for both influenza and COVID. And again, there are different tests, different sensitivities, but nonetheless, if we begin to see influenza in the community, then our recommendation is going to be, if you come in with a, quote, flu-like illness, that you're likely to get tested for both.
As a bit of a follow-up question, someone who regularly watches our series asked, how reliable and perhaps how difficult will it be for our national health groups, namely the CDC, to truly track the spread of COVID and influenza this year, since, it's all happening at the same time? Are we going to be able to truly track if there's a geographic region that's seeing an increase in flu because COVID is kind of, quote unquote, masking it?
Well, those are great questions. And I think what we've learned through this pandemic, which some of us who have been in public health for a while were concerned about, and that is we have underinvested in our public health system. And the data feeds, even within Harris County, which I'm sure Jason knows, it depends upon what data feeds you look at as to what the numbers look like in Harris County. And for instance, if you look at the TMC dashboard, you may see slightly different numbers than if you look at the county dashboard, or if you look at the state level, which I know is very confusing to the general public. So let me just say that you have to understand the data feeds, where they're coming from, in order to make sense of that, which I know is very confusing. I kind of like the TMC dashboard because they've had consistent data feeds since the beginning of the pandemic, so it's much easier to track changes. Having said that, I think that we begin to learn that we need much better ways of tracking communicable diseases throughout the country, including influenza and including COVID. We're getting much, much better at that. As you know, in the beginning, it was very, very difficult to get consistent numbers. A couple of different features, but COVID, which made it extremely difficult. One of the things that set us back by, I would say, at least a month or more, is the original CDC test kits that were sent out were defective. And those had to be returned. And at the time, we didn't have this global push to get multiple different platforms besides the test kits from the CDC. Now, we've made up a lot of time since that time, and our testing capacity, especially in Harris County, I have to tell you, is excellent. You can get drive-through testing now in any number of locations. So, and the turnaround time is also much better. You can get a test result back within a reasonable period of time, which was not the case a couple of months ago. So we've come a long way. So I think once we get those in place, we have good testing capabilities for influenza. I think the key thing is that we report things to the health department so they can be tracked. Same thing, we're working with the health department now that schools are open. How do we track what's happening within our schools? And there is a reporting mechanism in place, and we're trying to encourage schools to do this real time so we can get one step ahead. And if we have to do contact tracing, we can do that. So I think we're getting better and better at this. The health departments have increase the numbers that are in their departments now so they can meet the needs. And one of the best things we can do actually for the health department is actually to decrease transmission in our community so we can stay at least a half a step ahead of either one of these viruses. But it's important to have good, accurate testing. For instance, if you test positive for only influenza and you're COVID negative, just that scenario, we actually have antivirals that we can use for influenza. So actually, a treatment and what we tell people to do may be different depending upon which virus you have. So all of that's important. I am cautiously optimistic because I know we're doing a better job here in our community, that will continue to get better and better, and the knowledge will continue to be better, and that knowledge gap I mentioned will decrease. So we're going to be better able to serve our community and provide really what I consider common sense things we can do to cut down on transmission.
You've brought up the TMC data multiple times, and I think one of the data points that we all monitor is our hospital bed capacity. I think that came up really, especially early on in COVID, and there's certainly been concerns at different times in the past few months. I think here in Texas, we're keeping eyes on El Paso, where, while we're recording this a few days prior, the governor just sent some more resources that way. So influenza, the flu, obviously has several 100,000 hospitalizations a year. As we enter flu season, is there anything that we perhaps learned during this pandemic to help us prepare for a potential surge and utilizing the resources that our hospitals have in place?
Well, I think it would be fair to say that in July and early August, where our hospital admissions were at the peak, that we learned a lot about how to convert units into COVID units, how to change the pressures, how to make sure we had adequate frontline nurses. And I have to give a big call out to them. They're the ones that stay with those patients 12 hours a day. I cannot tell you how much respect I have for them, because the stress level, if even folks like myself who have sort of an oversight activity in these and make sure we provide a safe environment for our healthcare workers, being there 12 hours a day is not the same as coming in for 15, 20 minutes. And big call outs to them. They deserve an awful lot of credit. But we learned a lot in our surge capacity. And one of the things that the TMC has provided for us is some administrative coordination. This was one of the first times in my lifetime that I remember that all the healthcare systems and the health department got together administratively to make sure we track the number of beds that were filled, what our capacity is, looking at surge, when should we shut down elective surgery as an example, when is it safe to reopen it, so we had enough beds to serve our community. So we can build on that experience, hopefully never getting to the point where we were in mid-July, but understanding that's a possibility, and also doing what we can. Again, we mentioned about preventing transmission for COVID, but remember, we have a safe vaccine for influenza also that needs to be optimized so that we don't have excessive number of respiratory admissions to our hospital for influenza at the same time trying to absorb what may be going on in our community for COVID. So prevention is so very important, and we have a vaccine for influenza. It's not a perfect vaccine, but it does work, and it does cut down on serious illness, and it does cut down on hospitalizations. It does cut down on number of deaths due to influenza. Hopefully we're going to have some vaccines soon for COVID-19, but we've got the influenza vaccine now. This is the time to be vaccinated.
You know, that parlays into my next question. I literally, about an hour before we recorded this, heard from someone who said they are not getting a flu shot this year because they're doing all the things that you mentioned about COVID protection, you know, social distancing, doing things outdoors, wearing a mask, but they weren't getting the flu shot. And that was very interesting that they said that. So I presume a lot of the people watching this have gotten the flu shot, but if someone's watching who may not have at this point, I know you gave some reasons why it's important to give a flu shot, but maybe beyond the traditional reasoning for getting a flu shot amidst the pandemic, what would you say to someone like the one that I talked to literally an hour ago?
Well, I would say it's a safe vaccine, that it may only protect you from getting influenza, but also, again, just like COVID, keeping the transmission down to others, especially in our most vulnerable. There really is no downside to getting an influenza vaccine. I mean, the side effects are extremely rare. We've been doing this technology for that vaccine now for decades. And so I think it's really important for us to try to reduce all respiratory viruses that are preventable. And one of them that we do have a vaccine for is influenza. So I think it's to me, I find it as a civic responsibility. It's a citizen kind of thing that we do for our fellow citizens. It's not just about me. It's about all the other people that we may come in contact with, that we may inadvertently transmit a preventable infection. And remember, just like I said for COVID, where maybe up to 40% of people who get COVID don't have any symptoms at all, there is a certain percentage of people with influenza who don't have symptoms, and they can shed virus 24 hours before they get symptoms, which could be inadvertently transmitted to somebody else. So I consider it a part of citizenship that we do all we can to protect each other.
I really appreciate that response. My next question is, as a parent of a young child, I feel an obligation, as you kind of said, it's citizenship, to other families to make good decisions about whether or not to send my son to school. I know you're advising multiple schools, and I really feel for not only the preschool families or the school families, but the preschool directors and the educators related to decisions they make. If the kid wakes up with a runny nose and we know that it's probably allergy related, do we hold them home? It's just very difficult. I think parents and educators are going through these decisions on a daily basis. What advice would you give to someone, say in my shoes or an educator's shoes, about how to best handle these kind of dilemmas?
I'll get to the first dilemma, and that's for all of us. Any of us who may be ill should stay home. That's the easy one. And I have to tell you, as a physician, back in my younger days, it was sort of like a badge of honor never to miss a day of work. Well, we've learned that that's not the right thing to do. And so whether you're a physician or a teacher or a student, if you're ill, you should stay home. So that's the first bit of advice. The second, in terms of whether or not you should send your child to school, you need to think about a couple of things. First of all, is your child healthy? Does your child have any underlying medical problems that perhaps might persuade me perhaps to homeschool or use it or get my child remotely? Just that's a consideration. But if your child is otherwise healthy, up to date on immunizations, I want to repeat that because we fell behind on immunizations during the initial wave of COVID because doctors' offices were shut down and people were afraid to go to doctors' offices. So make sure you keep up with your pediatric immunization. The next thing you need to look at is look at the school your child is going to. Find out what their plan has been to open safely. And I want to emphasize the word safely. It's not just a matter of opening. It's a matter of making sure you have those things in place that can reduce transmission while the child, the teacher, and other staff are in your building. And Becker is an example where they've done a superb job of making sure that they're social distancing. The children who are old enough wear masks, that they're washing their hands all the time. We have a guidance about how many children can be in the bathroom at the same time. We make sure our ventilation is good within the school. We make sure that the people get screened before they come in the building. That we use disinfection in the high touch areas and do a thorough disinfection at night. These are some of the mitigation steps that are being done in schools to safely open. And I can tell you that it's not just because of me, but the schools that I've advised that have opened, they've been able to open safely so far. And I knock on wood, if you would. And most of the cases that we've seen in those schools are not transmission within the school, they're transmission within the community. And then what do you do when you get a report that a child tests positive? What is the school's response to that? We try to keep especially the younger children in their own pods so that if there's a need to close a class, we only close that class and not the whole school. It's a little bit more difficult in high schools and stuff, but there are things that you can do. But I can say honestly that we can control the environment in which your child comes, because we can enforce hand hygiene. We can enforce masking for the child over age 3. We can enforce all the bathroom, what they do when they eat, all those things that we can do, and making sure they're social distance, putting plexiglass up in the right places as an example. We can make it as safe as possible for your child to come to school. And by the way, as you know, there's a big social and psychological thing that occurs when your child goes to school in their development. So it's important for their development, and we want to make it safe. I've told every school that I've worked with, every business I've worked with, every congregation I've worked with, I'm not here to tell you that I can make it zero risk, but I'm here to tell you I can control your environment that you're in to make the risk as low as possible, because it's, of course, about your child. And obviously children can get infected. They tend not, fortunately, to get very sick with it. A lot of them don't get any symptoms at all. But it's also about transmission to families. If you're living in a multi-generational home where you have grandparents, as an example, that may be at high risk. So it's by trying to prevent transmission, not just within the school, but we also want that to transmit into their day-to-day living outside of school. And that's, by the way, one of the biggest challenges is what the students do after they leave the school. Do they forget about all the principles of social distancing and masking? I can tell you, we just had Halloween, Jason, and there were people in older students who didn't abide by all of those precautions when they went trick-or-treating. And we've had a case or two out there where they haven't done that. So you need to use the same principles both inside the school and in the community. I know that if you're a high schooler or the college kids coming home in Thanksgiving, as you know what happens on college campuses, they like to congregate. We've got to maintain those basic principles for all of us.
You brought up Halloween, but and Thanksgiving, and Thanksgiving is coming up in a few weeks, and the winter holiday season, as we call it, a month away. So the amount of people traveling is certainly going to start creeping up. I think a lot more people are obviously traveling via the roads versus air. But are there extra precautions you recommend in general as it relates to these holiday celebrations that bring together multiple generations, or maybe even more as it relates to the travel situation, if you will, in the coming weeks?
Well, let me do the travel first, because that's actually the easiest one. Obviously, if you're going to go by air, but by the way, I think air travel is relatively safe. They have very good circulation. Most of the airlines are blocking out middle seats. I do advise that, of course, you're going to be required to, but I would advise that you, of course, mask and you have some protective eyewear, a face shield or goggles when you're on the airline itself. And of course, you bring hand sanitizer with you so you can frequently wash your hands. And try to take direct flights. So that's the, now if you're going to travel on the road, obviously if you can travel nonstop, if you would, in one day from point A to point B, that's helpful. You can bring snacks along the way. You're probably going to have to stop along the way, but make sure you wash your hands, etc. So I think you can safely do that. If you're going to travel multiple days, choose a hotel of a national chain, who, by the way, have very good procedures in place. Often they block out rooms for a couple of days between individuals. They do thorough cleaning. So I think choose your sites where you stop very carefully. You can do that. But I think more important, remember the college kids, most of them are going to come home and they're not going back to school after Thanksgiving. They're going to be with us for an extended period of time. And of course, Thanksgiving is coming. First of all, I'll make the emphasis, we don't want big crowds. That's, you want to avoid that. And you want to try to create what's called a family bubble. And you'll have to kind of work on that about who should be in that family bubble. If someone's coming in from out of town and not part of your immediate bundle here in Houston, this is going to be difficult, especially for the college kids. It would be really nice if they could self-quarantine for a couple of weeks before they come. As you know, the college kids, that may be very, very difficult. I also advise for those people to be tested, probably within 3 days before they come to your community. And obviously, if you test positive, you shouldn't come. I think that's pretty obvious. For the college students who are staying here, they're probably going to have a very, very difficult time quarantining before they come, but they should get tested before they come. And I would advise they get tested 1 or 2 more times after they come. And they may, when they come in, perhaps wear masks when they're in common space, especially with the more vulnerable people within that family bubble, until it's clear that they've passed that 2-week quarantine period, that they've now created a safe family bubble. So be very, very careful with people that are outside your immediate bubble, in including a larger family bundle. There are things you can do, such as testing, trying to self-quarantine before you see them. If for some reason you're not able to do all of those things and you're going to be in a common space, especially indoors, try to wear masks. If you can have outdoor gatherings, that's even better. And again, this is a better time of the year. Probably the more difficult thing is when you eat. And when you do take off your mask, you want to make sure that, again, if you're creating a family bubble, making sure you social distance and stay 6 or more feet away while your mask is off. So those are the kinds of things you can do. I think you can create that family bubble, but you're going to have to work on it and plan ahead of time. This is the time to start planning about who should be in your family bundle and avoid the larger crowds. I mean, if you want to get up to 10 to 12, that's sort of a number that we kind of throw out as a reasonable number. But those family dinners of 25 to 30 people for Thanksgiving, probably you're going to have to skip this year if you want to be absolutely safe.
Every week I ask guests towards the end of our conversation, what is going to stick? And I think you bring a very interesting lens, because we've been talking to a lot of business people or nonprofit managers. I think as I ask you, I'm curious what in our daily life, our day-to-day happenings, is just going to be something long-term that we should all say, this is it. This is what we should expect, and this is what it's going to be going forward.
Well, I think there is going to be a new norm for a period of time. It's going to be a while for vaccines to be distributed widely to the general public. Some of us in high risk, such as healthcare, who are older, have underlying medical problems, will be prioritized first. We don't know exactly how good the vaccines are going to do. and how long the vaccine will last. It may be like influenza vaccine where we may have to be re-immunized every year. But no question, once we have a much more widely effective vaccine that the general public can have, we'll begin to take the first steps to see whether or not we can begin to relax some of the norms that we're experiencing now. But I think for the foreseeable future, Jason, it's going to be just like we discussed: masking, social distancing, hand hygiene, avoiding large crowds, and we're beginning to adjust to that. And we can continue to have some semblance of, and I'll say, the new norm. An example of that would be, I'll use the Houston Symphony as an example. They've completely revised their season to play pieces of music that require fewer musicians on the stage. They allow up to 150 people now in the audience to come that are, let me tell you, very socially distanced within Jones Hall. They've collaborated to find out how far apart certain musicians have to be with one another based on how much droplet may be created by playing a certain instrument. And they've learned to adjust. And I think we'll see more examples of that, but we can keep these things alive only if we can keep the number of cases in our community down to a manageable level. And the way to do that are the steps that we've already outlined earlier in this interview. I'm not one of these people who thinks the glass is half empty. I really think the glass is half full. I am not somebody who thinks we're going to have a dark winter, as you've probably heard some people talk about locally, because I believe, and I've seen, that we're being much more careful about wearing masks. I mean, the mask use has gone up significantly since Doggo put in that mandate in June, and I see it continuing. My only, again, caution is when the college students come home and how we adjust to that and how we instill upon them the sense of citizenship that they have a duty and an obligation to protect others. And if we can do that, and we do this consistently well, I think we can manage the number of cases in our community, which we are doing right now, by the way. I want to say on a positive note, we have seen a minimal uptake in COVID activity in Houston, but it's at a very low level compared to what's going on in El Paso, which you mentioned earlier. By the way, I will tell you, Lubbock is also experiencing incredible numbers of cases. And then if you go up to the Midwest, like Chicago, Milwaukee, Houston and Austin and San Antonio, we're faring okay, but it's going to take constant work on all of our parts to keep the numbers down.
And then my last question is this: is there anything that you feel, generally speaking, that is worth reiterating that we've touched on, or maybe a data point that you rely on personally that you think we should share with those who are watching today that might be a good resource?
Yeah, there's a couple of data points that I rely on, and I look at I mentioned earlier the TMC dashboard is one that I rely on more than the county, only because the data points have been more consistently captured. I look at the percent positive tests in our community. So as an example, in July, our test positivity rate was close to 25%. That means 1 in every 4 people who got tested had COVID. We're now down to less than 5%, and we're continuing to see that rate less than 5%. It's a little bit higher in the Harris County dashboard for those of you who look at both, and that's because the data feeds are different, and Harris County is also doing contact tracing, so just so people get confused. The second, of course, I will also look at hospitalization rates, because one of the reasons we went into shelter in place was to keep the rates down so that our hospitals could adjust to an increasing volume. So that's another one that I look at is hospitalization rate. It's a little bit of a delayed measure because it takes a week or two after someone gets infected for those unfortunate 10% who may be sick enough to get COVID to be hospitalized. So it's about a couple of week delay. You can look at new cases, but again, that's going to be dependent upon how many tests are being done. And then there's a number that you'll see on the TMC dashboard called the reproductive number. And that means for the index case, that is the one, let's say in a household that is the first to get infected, how many can they transmit to other people in their household? And we like to see that number at 1 or less. okay, because that means we're controlling transmission. Right now, the number is slightly above 1, but it hasn't continued to go up. And that gives me somewhat cautious optimism that we see the rates holding, even though it's been slightly increased. So those are the kind of numbers that I look like in our community. Track that, and I would also advise you, don't look at rates every day. Don't look at hospitalizations on any one given day. Sometimes there's data dumps of positive tests that come in, especially after the weekend. Look at the trends per week and see where that's going, because that'll give you a much better idea of what's going on in our community. So my last parting words is, I'm cautiously optimistic because I know everybody who's hopefully going to view this is going to do the right thing. And they're going to influence others in their environment to also do the right thing. And when your children come home from college, follow the steps we talked about before about getting them tested and making sure they understand their obligation as a citizen of our community to keep their transmission rate, not only among the older and the others, but remember other people in their environment, because they're going to transmit to other people as well. It's sort of like a chain reaction that one affects another, who may come in contact in a multi-generational house. They come in contact with their grandparents over the holiday. Oh my gosh, I didn't know I was infected. And now grandpa's in the ICU. So that's my obligation. Be a good citizen, do the right thing. We can have some semblance of this new norm, but we don't want it taken away from us by being irresponsible. So that's my message.
Well, Ed, I do appreciate you coming on and sharing some valuable information with our viewers today. And I think this is going to be really beneficial. And I think you gave a call to action to quite a few people.
I hope that, listen, what drives me in all the volunteer work I'm doing around this is to try to make a difference. I have a strong love for this community. I've been in this community since the 1960s. I think we have a really terrific community, medically and otherwise. And I really believe in our community doing the right thing. We always have when a call to action occurs, whether it's Harvey or any other major disaster, this community has always stepped up. And I see that happening now, but we have to sustain it for a little bit longer.
Well, thank you, Ed. Again, thanks for coming on and sharing your wisdom with us. As always, I'd like to thank David Tanner, who is behind the scenes recording this and helping us with technical things that could possibly come up. And for those who would like to watch future episodes, always be on the lookout. We usually air these Wednesdays at noon, but you can always check emmanuelhouston.org to see updates. And for those who are synagogue members, check your synagogue communications to see what's cooking. And lastly, as a reminder, if you missed this episode when it aired live, or any episodes you want to catch, whether it's Judge Lena Hidalgo or Judge Bob Schaefer or any of the great guests we've had on, you can always check that out on the Emmanuel YouTube channel. And for now, we will see you later. Have a good day.